Hi, Shayna. How are you?
I'm good. How are you today?
Good. I'm glad to be here once again we were just saying, how many times have we done this? It's been fun every time we do. And so we are welcoming yet another class year, another year of graduates taking the exam, and all the other folks who are moving from state to state and for whatever reason need to take a licensing exam too. So we're hoping what we're sharing today is going to be helpful in getting them ready for the ADEX dental hygiene simulated patient exam.
Well, it's an exciting time. This is always a thrill for me to be here with you. So thanks for taking a few minutes. The Pat and Shayna show, as we like to call it. For those of you just joining, I'm Shayna Overfelt, School Programs Director for CDCA Reb. And Pat is a loved and beloved senior advisor of this organization. So Pat, if you're ready, I'm gonna go ahead and start sharing our screen and we'll get on with this.
We will get on. And what we want to tell people is that we're glad you're here. We're glad you're watching this video. And for those of you that are seeing it for the first time, we always recommend that this is a supplement to the manual. It's not a substitute for the manual. So please, the manuals are online, and it's not that thick of a document now. It's
16 pages.
So it's very doable. And our recommendation is which one you want to do first. If you're here with us today, great. If you haven't done the manual, read the manual yet, then do that next, or flipped either way. But it's meant to be a supplement. A lot of what we say is in the manual, but there's a lot of things in the manual that we haven't covered here today. So they're meant to be hand in hand. And Shane is also later going to share with you a lot of other resources to help you get through this process too. We always say we can't do the clinical skills for you. You have to scale and calculus detection and probing, but we can certainly help you with the process and the rest of it. And that's what we're going to try to do today, is to put you at ease and give you some good information about plowing your way through the process of it.
Yeah.
And I think you're going to find out it's not so bad.
No, absolutely not. And again, Pat and I enjoy doing this, so thanks for being here. A couple of things I'm going to cover here just to begin with are kind of what's going on nationally in dental hygiene. I think it's good for you all to kind of have an idea of what you are actually getting with the ADEX exam and what's happening across the country. So right now for dental hygiene licensure, right, licensure by examination, we have about 210 dental hygiene programs across the United States who actually host a licensure exam with CDCA REB-CETA. Of that, there are about 250 dental hygiene programs that participate in an examination. Not all schools are big enough to host an exam. So then we have one of my favorite statistics is that over 80% of dental hygiene students, and I realize that not all of you are students watching this video, but as of current class students, over 80% of those are taking an ADEX examination. So Pat, your faculty can remember a time when this portability wasn't so common for everybody. And so having this opportunity for you all to take a single licensure exam and be able to go almost anywhere in the United States is quite impressive and a task that many before you are proud to offer. I wanted to show you these two maps as well. You're looking at a map on the left-hand side that is based on a patient-based clinical exam, and the map on the right is based on a simulated patient-based clinical examination. All the states that are in purple except the ADEX examination. These maps are interactive on our website. So what you're looking at now is, as of what's today, Pat, January 20th, this is the static acceptance that you're seeing. But if you have questions, please go to our website. You're getting a live interactive view right from our website that we keep track of. So while these maps today are current, we could see additional changes, additional acceptance across the country, particularly in Wyoming and Georgia. So there are changes coming in those states. So no, as of today, this is current, but do check our website as you're looking for portability across the country.
And Shana, it really is, just mentioning, this is really one of the most up-to-dates. You did say to contact the state board that in the states that they're interested in licensure, but even the professional associations, ADHA and others rely on these maps. And it's something that this organization is really proud of and has worked hard to keep current. And it is just a wonderful resource for all of you that want to take this examination and really take advantage of the portability or help you in the decision about what exam you should be taking.
Yeah, and
I just put that plug.
right. You're right. And it is on you as the student or candidate taking this exam to make sure that the state board is still accepting. We put these out as useful tools, but definitely put the statement on there in small print, right? Fine print. Please make sure you do check with the state board if there are any questions about licensure by examination. So the other thing we wanted to cover really quick is what is ADEX, right? We have so many acronyms that are now involved. ADEX, CDCA, REB, CETA, which is now one organization, all administering an ADEX exam. We just kind of wanted to quickly touch on that you are taking an ADEX examination administered by CDCA, REB, CETA. So that's how the portability comes into play, is the ADEX exam is what you will be taking for your licensure by examination. ADEX exam includes either a patient-based exam clinical component and an OSCE, or a simulated patient-based clinical exam and an OSCE. And Pat, with all of her wisdom, is going to take us down the road of what is an OSCE here in just a few minutes. The last thing we wanted to cover here, just that I'm going to cover, is the exam cost. So the exam cost is $1,075. That includes both components. So either your clinical component and your OSCE, whether that's on patient or simulated patient. Both of those are included in the fee. And this year we are happy to announce that we also are offering a complimentary retake. So should you need a retake, that next retake would be part of the examination cost of $1,075. So outside of any facility fees, if a school has a facility usage fee, then you may have to pay that. But the exam cost itself, if you need a second retake, is complimentary and built into the fee. So Pat, any questions, anything I've missed on just portability, exam cost, where we're heading in the future?
I think one question that did come up at our recent educators conference was, does that retake include the CSCE OSCE?
Great question. So the CSCE is not included in that complimentary retake. It is based in the clinical setting. So whether it's a patient-based clinical exam or the simulated patient-based clinical exam, those are the components that are part of the complimentary retake. If you are unsuccessful on the OSCE, then there is a retake fee of $275 for that clinical OSCE retake. So great question, Pat. Thanks. And with that, your cue is up, Pat. Okay. 2023.
Okay, so we're doing, let's just briefly review the CSCE OSCE. This is the simulated clinical exam that is taken most of the time at a Prometric center. It is something that you register for when you register to take your clinical exam, and you pay your fees and your registration. You'll get a code that will then have you be able to sign up for the CSCE OSCE. You can sign up to take it whenever you're ready. Some people take it earlier in the school year or in the fall because they feel that they're ready for it. Others wait and take it after they've taken their clinical. So it's up to you. Whenever you're feeling ready, you can check with Prometric and see how far out that they're scheduling, but it's a separate registration directly with Prometric. And again, you take it on your own whenever it is that you're feeling comfortable and ready to do it. So this is the content of the OSCE exam. The content has been put together based on an occupational analysis, which was a survey of hundreds and hundreds of practicing dentists and dental hygienists. And we just asked them, what is it that an entry-level hygienist needs to know? And what is it that you do in practice? How important is it to the overall health and safety of the patient? And how frequently do you do it? That information has all been gathered back by ADEX. And this examination, both the clinical components and this OSCE components, are all of that entry-level skills, all of those skills that you need to have. And we've split it up. What's been best to examine in a clinical setting and what's been best to do in a simulated clinical. So this is the content of the simulated clinical. It's worth about 100 points. It's not 100 questions because some are worth more points, or alternative items might have half points or whatever, but this is basically it. It's worth 100 points, so you don't have to be really good at math to know that a 12% means that there's about 12 questions on that particular topic. So these are some of the types. I don't want to say it's ever fun to take an exam, but this is just really an interactive exam. Over 30% or even higher than that now are these alternative item types, where it just is testing you. It's testing you a little bit more in the depth of your information, of your knowledge and what you know. We have we don't have straight multiple choice, but if you look on the upper left, that would be one that would be on intra and extra oral exam. We have matching. And if you look down, that's up in the upper right. If you look at the bottom of that with that yellow square, you can see that this type of matching isn't just draw one line to one response. It could be one response on the right. It could be two, it could be three. It's just an interesting way and a thorough way of testing. Lower left, the drag and drops. This is a good, I have to put on my glasses for this one. It gives you lots of options. You look at that slide and you just look and see, what's there. Is it present or is it not? So it's more interesting to do. It's definitely, you can see how it's clinically oriented, and it's a great way to test your knowledge. The hotspot is a great way for you to be able, if we ask you to demonstrate horizontal, vertical bone loss, caries, furcations. So you can see how when we say it's a clinical simulated, it's like looking in the mouth. How do you?
I'm gonna ask you on that. I get a lot of questions about what that purple. We've got the radiograph in front, and we've got the radiograph in purple behind it with a green octagon type shape. Can you kind of tell them what that is?
So the radiograph in front is going to be what you're going to see. That's the radiograph, that's going to have the question, and it's going to, so the question here is mark the caries on the radiograph as shown. What is as shown is the bottom one that looks like a radiograph. It's the black and white. The purple with that little green octagon, that's the hotspot. So that's where, you don't see that, but that's what's the behind the scenes technology of a hotspot. You would be, as long as you touched anywhere within the boundaries of that green octagon, then you would be correct. And with this type of question, you could have two hotspots. It could ask you to do one vertical and one horizontal bone loss. But that's what the purple is, the background. The black and white is what you would see and what you would touch right on the screen in response to the questions. So that's the CSCE. As I say, it's about 100 points. The best way to prepare for it is everyday clinic. It is entry level. It's not meant to be a national board. It's not meant to test what national boards test. Your preparation is what you see and do in clinic, what you see and do in practice. It is that basically clinical. Candidates tend to be very successful in this exam. And it is, I think the reason for the success is that it is what your schools have prepared you for. It's entry level. You've been through the programs or you've been out in practice, and this is your opportunity to share your knowledge on what you've learned clinically. So
the one thing I'll add here, Pat, is that they do get their scores right there on the at Prometric. So as soon as they complete the examination, their scores are given to them right then, whether it's on the screen or as they walk out. So those results are as instant as it gets once they have finished the exam.
Right. And remember to, when they're going to tell you what you need to bring to register, and follow those instructions carefully. They do ask for 2 forms of ID, and when they say current, they mean that it's not an expired license or it's not an expired ID. So just remember that when you do go, and getting your results right away is terrific. So that's the first part, the CSCE OSCE. Whether you take it first or not makes no difference, but that's one part of the ADEX exam. Now let's talk about the actual simulated patient treatment. This is the one that I think you're probably most interested in hearing the information about. The examination is given on 2 arches. The calculus detection is done on the maxillary arch, and the calculus removal is done on the mandible. You are going to be working in 1 quadrant on the maxilla, and you'll be assigned 1 quadrant in the mandible, but you will be working in both. Ultrasonics are allowed in this examination if the school allows them. During COVID, many schools were not allowing them. I think it's definitely the exception now, wouldn't you say, Shayna?
I would. I can't think of one at the moment that isn't allowing ultrasonics.
And it is an examination. The product itself, the Simpro DH, the product itself is a very realistic product. The tissue is realistic. It certainly, it's an examination that you can use ultrasonics and be very successful, but it's also an examination that if you don't use ultrasonics, it's very doable as a hand scaling examination also. So there are people who don't use ultrasonics. Your treatment time, once everybody is started up, your treatment time for this is 2 hours. Within that 2 hours, we'll go over in a few minutes what procedures you are going to be performing, but one that you're not going to be performing is polishing. So there is no polishing on this simulated patient exam. We do evaluate hard and soft tissue damage, and that is done at the end. It's done by a method called penalty points. If it is expected that there will not be hard or soft tissue damage, but if there is, you will lose some points from your total score after you've accrued all of the points on the grading form that we're going to be looking at. If you do have tissue damage, we'll go over, but there will be points that are deducted. But I say the tissue is very realistic. The hard tissue, the soft tissue. We will say it's enamel is the hardest substance in the body. So these teeth are not as hard as enamel, but they are they're realistic. And you don't have to worry with normal instrumentation about damaging the teeth or the tissue. Our administrative format, everybody's going to start at once. It'll be a group start and a group finish, and 2 hours in between that start and finish. And that's what we call a uniform start. The infection control, because it is a simulated patient exam, the infection control that we do require at a minimum is mask, gloves, eyewear, and a gown. If a school has additional infection control procedures or protocols that they would like the candidates at that testing site to follow, then we will honor that request, and we will follow whatever it is that the school determines. But you can expect at least mask, gloves, eyewear, and a gown. There are no radiographs. There are no requirements for radiographs. You don't have to take them. We don't use them. They're not used to show where calculus is, so we don't require them. This exam is totally tactile. You are using Explorer to do your calculus detection, to feel it. You're using your instruments and your Explorers to find it, to remove it, and to check yourself. I guess this is one question that Shana had asked me before, and I want to make sure that I include it. That's the same for you and for the grading. The examiners, it's all tactile, and examiners are not taking the teeth out of the typodonts or out of the mannequins and looking at them and grading. Everything is being done the same way that you're going to be exploring in the sulcus and around the tooth surface. That's the way they're going to be graded too. The graders on taking out teeth. One other thing that we just want you to know is that the week before the examination, you'll be receiving an email. There is going to be a question and answer period that will be scheduled. It usually lasts about an hour, 45 minutes to an hour, depending on the size of the group. It'll be held by your chief examiner. And it's another wonderful opportunity for you to get information about the site and ask questions. We talked before about the start. What is a uniform start? It's, again, everybody going in at the same time. Before the exam starts, when you're all in clinic and you're all set up, we will go around and do what we call a candidate check-in, making sure that your typodon is positioned correctly, and that you're treating the typodon in a position that you would treat a patient. You're not going to put them in these crazy positions that you couldn't put a patient in. We're going to confirm with you your assignments to make sure you understand the 3 assignments that you've been given. Sometimes we even have you point to make sure that you're not so nervous that you're thinking that the lower left is the lower right. So we'll confirm your assignments, and when everybody is checked in that way, the chief is going to announce that the group may begin. Once you do begin, you have 2 hours for treatment. We like to say that we will give you notifications at an hour, and we'll give you notifications at 15 minutes. And that's just to kind of help you keep track of time. But keeping track of time is your ultimate responsibility. But we certainly are going to try to help you and give you guidelines along the way. Remember, when the exam is over, it's over. When the chief announces that the exam is finished, instruments must go down immediately. And then you clean up your work area. Pack up all of your personal belongings and your instruments and everything, and meet with one of the examiners to enter your candidate findings that we're going to talk about in a minute. You're going to enter your findings, you're going to turn in all your exam materials, and then you're done.
Pat, I have a question for you.
Yeah.
I know the exam is 2 hours. If a candidate finishes before the 2 hours, do they have to wait, or are they allowed to pack up and take their belongings, as you said?
Yep. No, they do not have to stay for the full 2 hours. And that's something that I just want to mention. And don't feel pressure to stay for the 2 hours. And if you're finished beforehand, be confident to leave. We have both. A lot of people stay until the end, but a lot of people don't stay until the end. So you know how you feel, when you're done, and when you're done, you're done. Sometimes I say what happens between when you finish and when you leave can be called tissue trauma. You just keep going in and you keep going in and you check and you check and you check. When you're finished, and be confident in your decision, and you can leave, and the process is still the same. You just quietly pick up your stuff and come out and meet with us. This is a new form this year. This is our ACF form, assignment and candidate findings. The content is the same as it has been in the past. It just looks a little different. So if you've seen one from a previous manual or from another class, but it has all the same information, you're going to be assigned a quadrant. Up here on the top, it's the lower right. And everybody that gets a lower right assignment isn't getting the same exam. We have 5 versions of each quadrant's exam. So we have 10 versions of clinical examination on the mandible. When we come around and check you in to make sure that the patient positioning is correct and that you understand your assignments, we're going to put a number in there, and that's how we know that you've been checked in. You're going to be receiving this when you get when you show your ID, and this is part of your exam material. You're going to get that, and you're going to get a plastic bag. And we've got one here to hold up. You're going to get a plastic bag that looks like this, and this ACF form is going to be right in it. You can see Up there, you're going to put on a candidate label on it. It's important that everything that is part of your exam be labeled. You want your forms labeled, you want your typodont labeled, you want the bag that their typodont is in labeled. You're going to be given 33 labels, and you're going to use, I think, 3 of them or maybe 4 of them, and the rest are our souvenirs to you for the day. So
Pat,
this
I
is
ask you a question. You mentioned here the lower right. Are we allowed, or candidates allowed, to request the lower right or the lower left when they're checking in?
That's a real good try, Shayna, but no, no, you're going to receive this little bag right here, and in it is going to be your ACF form that's going to have what your assignment is. And it's you get what you get.
Yeah.
Is what it's going to be. So you're going to be assigned a quadrant, you're going to be assigned a version, and this is another assignment. This is your calculus detection findings. You're going to be assigned 4 teeth. Each version is going to have different teeth that they're assigned. And these calculus detection, remember, it's going to be up in the maxilla. No instruments up there other than an Explorer. And you're going to go up and you're going to indicate if you find any calculus, light, moderate, or heavy calculus. You're going to either signify by putting an X. Let's just say you find calculus on 12 mesial. You're either going to circle the yes, you're going to put an X through, whatever you're comfortable, you can fill in the box. If this is your worksheet, but you want to just put down, you're indicating your findings. Is there calculus, yes or no? There's always the question about, well, how do I know if it's calculus or if it's just grainy? This examination is not trying to trick you. It is if there is calculus, if your Explorer catches on subgingival calculus, and it has just that little bit of tug, then that means the calculus is present. We're not looking for root planing, that smoothness. We're talking for actual calculus. So here you are, it's 4 teeth, 4 surfaces. So this calculus detection is worth 16 points of your examination. Next is the removal assignment. I like to tell everybody, take your eyes back up to the top and say, what quadrant are you assigned? You're assigned to the lower right. And you want to scale every surface of every tooth in the lower right quadrant. What is here outlined here are 10 surfaces that, there are 12 surfaces in that lower right quadrant that is really called your selected surfaces. And what that means is you have your particular assignment in your version have been assigned 12 teeth for 12 surfaces for removal of calculus, and the point value is 5.5 points per surface. We're going to tell you what 10 of those are, and that's what's outlined there it's pink on my screen. Yep. Those are 10 of the 12 surfaces that have that hefty 5.5 point value. There are 2 others. The math is simple. There are 12, we're giving you 10. There are 2 others. Some people call them the mystery surfaces. Some call them the secret surfaces. But what they are, there's other 2 surfaces that are there. So what we're saying is there is more calculus on each quadrant than just the 10 surfaces that you're seeing there. So my recommendation is always, whatever the quadrant is, treat the typodont as you would a patient, and start wherever you start, the distal of the 3rd molar, the mesial of the central, however you start, and just scale the entire quadrant. That is your assignment, because there is additional calculus there that you must also remove. The point values are a little bit less, but you still have to remove it. After you've finished scaling and removed all of the deposits, that's when you want to probe. You're going to be assigned 2 teeth, an anterior and a posterior, and you're taking the 6 readings on each tooth. This is what we call your candidate findings. The probe readings that you're writing down and the calculus detection, circles, X's, filled in the blocks, whatever. Those findings are on this worksheet. And when you check out of the exam, you're going to enter those with one of the examiners into a tablet, into the electronic grading system. So this is your worksheet. That's why I say you can do whatever you want. You can do it in pen, you can do it in pencil, you can do it in red, you can put happy faces over the yeses and nos. whatever, as long as you can understand it, because you will be reading your findings to one of the examiners who will be putting it into the tablet, and then you're going to be given the opportunity to confirm that what was put into the tablet is correct. So that's the ACF form.
Pat, I have 2 questions off this form. So pocket depth measurements, is it plus or minus a millimeter in the measurement findings?
It is in scoring. It is a plus or minus. And in our calibration, our examiners are calibrated so that if the tissue goes over the line of the marking on the probe, the millimeter marking on the probe, then the probe reading is the higher number. So if it's at the 3 millimeter line and it goes over it, then your reading would be 4. That's how we calibrate. That's how examiners are calibrated.
And my second question is, can you, what we get a lot from candidates is there a base to the pocket? Are they going to be able to get an accurate measurement? Can you talk a little bit about what these pockets will represent to these students as they're measuring?
Sure, I'd be glad to. I think some of the, even from the very beginning, this is year 4 that we have done a simulated patient. And from the very beginning, our feedback on the pockets has been that it's very realistic. Yes, you will insert it and you will feel the resistance, you will feel the bottom of the pocket. Like in a patient, could you make that pocket deeper with a lot of effort? Yeah, you probably could, but you would just use the positioning, the insertion, the angulation, and the grasp that you would use in treating a patient. And there is a bottom to the pocket. I think you will find that it's realistic. When we said that there was we would check you in and then everybody would be starting at once. When the chief examiner says you may begin, we usually say it is 8:15, you may begin, and your finish time is 10:15. But what I want you to do is down here in the lower right, write in your finish time so that you know. When we say that it's maybe going to be 10:15, you're going to remember it for that minute, but then you're going to get in the zone and you're going to start scaling and doing your calculus detection, whatever, and you're going to forget. So write your finish time. When it's given to you at the beginning of the exam, write your finish time right on this sheet and you have it there for reference. So that's the ACF form. There are no radiographic requirements. I think we talked about that before. It's all tactile. Everything is tactile sense, so you don't have to, that's one requirement that you, in a patient exam that sometimes is difficult to obtain, and you don't need it here. So here's our scoring rubric. This is how you're graded. For calculus detection, you already saw that we had 4 teeth assigned. There's 4 surfaces on every tooth, so that's worth 16 points. Calculus removal, you're given a quadrant. We talked about those 12 surfaces. They're each worth 5.5, so that's 66. And for each one you miss, you would lose the 5.5 points. And for each one that you get, we call this an accrual. For each correct answer that you give, you gain points. The probing, there's 2 teeth. You're doing 6 measurements, so it's 12 points. When we give you that 15-minute heads up that there's 15 minutes left to the exam, the examiner is going to say to you, if you haven't done it yet, make sure to do your probing now. It's worth 12 points and you don't want to run out of time. So make sure that you get that done and you're conscious of that within your 2-hour period. The final case presentation is actually the rest of the calculus removal. So when you look at the 100 points of this examination, actually 72 points have to do with calculus removal. The 66, which are the selected surfaces, and then there's 6 additional points for those surfaces of calculus that are in your quadrant that are not part of your 12 selected. So that's again why I say your assignment is the entire quadrant and it's worth 100 points. The passing score for this examination is you have to accrue 75 points, at least 75. That is the passing score. But remember too, so that's how you accrue them, is by the 16, the 66, and going down for all of them. But now there's penalty points. So if you accrue, let's say you accrue 100 points, you were terrific, you removed all the calculus, you get everything on site, but you did a little tissue damage. This is how tissue damage is graded. It's at the end, two separate procedures. We'll do soft tissue first, and then we will do hard tissue. If you have one area, minor area of soft tissue damage, you will lose a point. So you're allowed 3 minor tissue traumas. I'm not encouraging it. I'm not saying that you should do it, but you are allowed that many and you would lose 3 points. But then this is the big tipping point. If you had 4 minor tissue areas, it goes from 3 points for 3 to 100 points. It converts 4 minor tissue trauma areas, converts to a major tissue trauma. And that's minus 100 points. That's failure of the exam. And you can see it's the same in the soft tissue column as it is over on the right in the hard tissue column. So you can lose points for both hard tissue and for soft tissue. On the bottom, and this is in the manual, just read, what is considered major and what is considered minor. One thing to keep in your head, if you convert this to a patient, any type of damage that would need intervention by sutures, periopacs, something like that, would be considered major. If it's something that would heal on its own in a patient, then that would be considered minor. So we take that criteria and also apply it to this simulated patient situation. So these points, these penalty points, would come off of the 100 points that you have accrued, or how many of the 100 points that you have accrued.
Pat, I think this is the one thing, though, we have students that stress over this part the most. This is their anxiety. This is the tipping point of anxiety in the simulated patient. Can you talk a little bit about really the hard and soft tissue trauma, though, show up very rarely as a reason for failure? Number one reason for failure in this exam is calculus removal, not removing the calculus. So can you just kind of reassure those watching around the hard and soft tissue trauma, because there's so much conversation around it, but it really doesn't equate to what we're seeing as an end result.
As results. Good. I'm glad you brought that up. I tried to imply that earlier, that the tissue is realistic, that with your instrumentation skills, there's plenty of room in that sulcus to bring either ultrasonic or piezo, whatever type of power scaler. There's room for it if it's adapted correctly, and there's also room for hand instruments. This is a very, the vast majority of people taking this examination are not producing any tissue trauma. But you're right, this seems to be, this trauma seems to be the trauma of people taking the examination. It shouldn't be. If you're adapting your instruments the way you've been taught and the way you are with patients, in order to produce some tissue trauma, I would say on the simulated patient, you would have to have one uncomfortable patient in the chair in adapting instruments. It would take, if you want to do the comparison, the contrast, it would be very, very uncomfortable for the patient in order to damage the simulated tissue. So trust your skills, adapt your instruments, and tissue trauma is not expected. It is the exception, far from the rule, for sure. And it's realistic. I really do think that you're going to find getting your instruments in there and being able to adapt mesially and distally, it's a good simulation of a real patient. So this is one of many videos, and Shane is going to tell you all of the other things that you can see and watch and participate in to prepare for this examination.
And if you found this video, you're on our YouTube channel already and see the plethora of videos that we've done year over year. There is one video besides this one of Pat and myself I'd like to direct you to, which is, it's 6 minutes and 16 seconds. It is a candidate who actually took the exam in the morning. She stayed in the afternoon. We recreated her full simulation day. But what she talks about as well is her experience and builds upon kind of what Pat has mentioned as far as hard and soft tissue trauma. She's actually also addressing her own personal experience and how she found it really wasn't an issue. So please take 6 minutes and 16 seconds after this video to watch that simulated patient experience from a candidate's perspective. She's talking to you just as she was the day she took the examination. It's very useful. It's one of our most watched videos besides the ones Pat and I make. So please do go check out that YouTube channel. You're already here. Check out that video for just additional information to help you support you in the process of taking the exam.
And I think if you watch that too, it helps you understand the manual. The candidate manual is written in a how you experience the exam format. And so if you see the video, you see what happens first and then next. It's just going to help put all of the pieces together. And I think one of the biggest things to be nervous about is the fear of the unknown. If you watch this, you're going to know exactly what it's going to be like on the day that you take it. You've taken mock boards probably, but not everybody has. So I think this is a great way of just if you watch this, the day you actually take your exam, you're going to be in familiar territory. And I think that's going to give you a level of confidence and calmness.
Yeah. And that's the goal. That's our goal, to support you through this examination process, which is why Pat and I've made these videos year after year, why we continue to put video content out there that goes along with and in conjunction to your manuals. So Pat, this has been a good time. Thank you so much for being a part of this process with me. I know the students and faculty out there who watch it appreciate it.
I think it's so much fun. I think you get the opportunity to do webinars with the schools, and I get the opportunity to see candidates out at exams and doing in exams, and it's just always fun. It's just that sometimes they'll say like, I know that voice. They'll say, how's Shana? So it's fun. We have fun doing them, but we also have fun meeting you as candidates. And our goal, as Shana said, is to help you, and we certainly enjoy it. And we hope you're going to find it all helpful. Good luck to everybody.
Good luck, everybody.
Bye.